I believe that we invest in healthcare as a system that has equity. And I want to say gender-affirming care, reproductive care, these are the care that the Trump administration has been trying to take away. And in fact, they're doing that by cutting funding, but also changing the funding criteria. Clearly, they're threatening funding for any health institutes that may be providing gender-affirming care. They already been trying to threaten to take away reproductive care. We have lawsuits fighting back. But if we have Medicare for all, we can then make sure that everything is funded. All these care that is required, it's necessary, is funded. So we know Medicare for all.
We have this tiny population, probably 1% of the population, transgender people who are just trying to live their lives, have health care. And we have an entire political movement, including the President of the United States, who are so obsessed with this tiny population, are scapegoating them for all sorts of societal problems. And it's bullshit. For gender-affirming care, this is health care. This is not optional. And we have prioritized that in California. In the legislature, I have worked to make sure that we are providing strong healthcare access to trans people, that we are making sure that trans people can find providers who are culturally competent and able to provide that care. I know so many families in this community in San Francisco, parents with trans kids, and they are living in fear right now because of what this administration and this cult, the MAGA cult, are doing. There is not a comprehensive civil rights law for LGBTQ people at the federal level, which is outrageous. We need to pass that. It needs to fully protect trans people, including access to healthcare, and it needs to override all of the red state hate laws that have been passed.
Right now, we're seeing, even in California, these hospitals, these private hospitals are supposed to provide gender-affirming care. They're not doing it because they're worried about the federal government taking away their funding, and they're worried about pressure from the Trump administration. We have to provide counter-pressure on that. What that means is if you're a hospital where you're legally required to provide gender-affirming care and you're not doing it, I will drag your CEO in front of Congress and make you answer for that. You know, when I say Medicare for all, I mean Medicare for all. That means undocumented immigrants. That means trans kids and trans adults. It's actually a better system when you include everybody in your system. It's better to actually create a Medicare for all system, a universal healthcare system where everybody is included. And that's got to be part of a vision of what we pitch as Democrats. People are looking for a different vision. And that vision has to be one of a way to build an economy that truly works for all, that includes everybody.